Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Tarafder Shahniam Ahmed, Associate Professor of Department of Pharmacology, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. Dear students, welcome to my second episode on lectures describing the drugs acting on the sympathetic nervous system. In previous class, we have already discussed the basic prerequisite concepts about this chapter. Today, we shall discuss further about some definitions and classifications. So, let us go straight away to our slides. The first slide is showing the definition of sympathomimetic drugs. What is sympathomimetic drugs? Drugs that mimic or imitate the actions of stimulation of adrenergic nerves. Sympathomimetic drugs are also known as adrenergic drugs, adrenergic receptor or adrenoceptor agonist or activators. So, you should be able to understand these terminologies when given alternatively in your professional exam questions. Then, what is sympatholytics? Drugs that antagonize the action of sympathomimetics at the adrenergic receptor site are called sympatholytic drugs. The sympatholytic drugs also have other synonyms such as anti-adrenergic drugs, adrenergic receptor blockers or sympathoplegic drugs. Let us discuss about the biosynthesis of adrenaline and noradrenaline. We already know that adrenaline is synthesized from the precursor amino acid tyrosine. Tyrosine is converted to DOPA by tyrosine hydroxylase enzyme. DOPA is then converted into dopamine by DOPA decarboxylase enzyme, and finally dopamine is converted to noradrenaline by dopamine beta hydroxylase. Please note that in the slide I have highlighted the rate limiting step in red color, which is the conversion of DOPA from its precursor tyrosine. This is the rate limiting step. And noradrenaline is actually converted into adrenaline by the enzyme phenylethanolamine N-methyl transferase within the adrenal medulla. Please remember this, the conversion of noradrenaline into adrenaline occurs within the adrenal medulla. Adrenal medulla means suprarenal gland. So, these are the basic steps of adrenaline and noradrenaline synthesis. There is a very common question asked during your professional exam: what is the fate of adrenaline? What are the consequences of adrenaline release? I have already discussed this in my previous lecture. These are the main points you should be able to understand and reproduce. There is uptake 1. More than 80% of the secreted or released adrenaline is transported back into the noradrenergic neurons, followed by vesicular storage or mitochondrial destruction by monoamino oxidase enzyme. The second consequence or fate of adrenaline is it is metabolized. Diffusion from the synapse into the circulation and ultimate enzymatic destruction in the liver by monoamine oxidase as well as catecholamine transferase. And the very few amount that is still left there in the synaptic cleft is actively transported back into the non-neuronal cells, followed by enzymatic inactivation by catechol-O-methyltransferase. The following slide is showing you the classification of adrenoceptors, majorly classified into two categories, alpha and beta. Alpha receptors is again subdivided into alpha 1 and alpha 2 receptors. Beta receptors are subdivided into beta 1, beta 2 and beta 3 receptors. This figure or flow chart very simplification of the occurrence of these receptors, where they occur. Okay. The alpha 1 receptors are found in postsynaptic effector cells of vascular smooth muscle, radial muscle of the eye and adipocytes, whereas the alpha 2 receptors are presynaptic autoreceptors found in smooth muscles, platelets and adipocytes. The beta 1 receptors are all postsynaptic and found in heart, myoepithelial cells of juxtaglomerular apparatus. These 2 points should be memorized because the sites of occurrence of beta 1 receptors are frequently asked during the exam. Beta 2 receptors are found in postsynaptic effector cells of bronchial smooth muscles, uterine smooth muscles and as well as smooth muscles of skeletal muscle vasculature. You should also remember the sites of occurrence of beta 2 receptors, because this will help you in the further chapters that discuss drugs acting on bronchial asthma. So, this is very important. Beta 3 receptors are found mainly in the adipocytes. Now, we will show you the classification of dopamine receptors. Dopamine receptors are mainly classified into two major groups, DA1 family and DA2 family. The difference between DA1 and DA2 family is DA1 family of receptors act by increasing the cyclic AMP, whereas the DA2 family acts by decreasing the concentrations of cyclic AMP. So, the D1 and D5 receptors belong to DA1 family and D2, D3 and D4 receptors belong to the DA2 family. So, please memorize these sites of occurrence of dopamine receptors as well. It will be very important for your further chapters. Now, let us classify sympathomimetic drugs according to their chemical nature. They are catecholamines. Why they are called catecholamines? Because they contain a catechol ring in their structure. They cannot be given orally because broken down by catechol-O-methyltransferase and monoamine oxidase enzymes. They cannot cross the blood-brain barrier. So, catecholamines are namely adrenaline, noradrenaline and dopamine. Then there is non-catecholamines. That means they do not contain any catechol ring in their structure and they can be given orally. For example, ephedrine and amphetamine. Other sympathomimetic drugs comprises drugs that inhibit the reuptake 1, such as cocaine, tricyclic antidepressant and noradrenaline reuptake inhibitors such as reboxetine, serotonin norepinephrine reuptake inhibitors such as duloxetine, venlafaxine, These all drugs act by inhibiting the NET transporter. Then there is drug that inhibit catecholamine metabolism. As we know, catecholamines are majorly metabolized by two groups of enzymes, monoamine oxidase and catechol O-methyltransferase. Monoamine oxidase inhibitors are phenelgene, tranylcypromine, moclobemide. Selegiline is also a monoamine oxidase inhibitor which is used in Parkinsonism. According to mode of action, these sympathomimetic drugs can be again classified in another way by directly acting drugs and indirectly acting drugs. Directly acting drugs are again non-selective or selective. Non-selective drugs, they actually generally occupies the all alpha and beta receptors, for example adrenaline, noradrenaline, isoprenaline and dopamine. But when we say that there are few selective drugs which selectively occupy or acts as an agonist on specific alpha 1 receptors, alpha 2 receptors and so on. Alpha 1 selective agonists are phenylephrine, methoxamine. Alpha 2 agonists are methyl-dopa, clonidine. Beta 1 agonists are dobutamine, prenalterol and so on. You can find numerous drugs and their examples in your textbook. Please write it down and just memorize them. Okay? But be careful about the spelling of these drugs, because most of you when you write down your exam paper do mistakes regarding your spelling. The indirectly acting drugs are amphetamine and tyramine, and there are also mixed acting drugs such as ephedrine. Now, let us see what are the clinical uses or indication of uses of these adrenergic drugs. These adrenergic or sympathomimetic drugs are used in anaphylactic shock, hypoglycemic shock, hypovolemic shock and cardiogenic shock. They are also used in bronchial asthma, nasal congestion. You know that we in practice we use adrenaline along with combination with a local anesthetic to prolong its duration of action and also as a vasoconstrictor to secure local hemostasis. So, these are the indications of adrenaline or adrenergic drugs. The next slide is a figure showing the synthesis and fate of adrenaline as well as other sympathomimetic drugs, and this figure is taken from your textbook Lippincott's Illustrated Reviews of Pharmacology 5th edition. Please go through this figure and study in details. There is numbered steps shown how these drugs are synthesized and what are their fates. And in the next class we shall discuss about the pharmacological effects of sympathomimetic drugs on different systems. For now, that is all for today. Thank you all. Assalamu alaikum wa rahmatullahi wa barakatuh.